Panning. Mhm. 2 years ago, I got to spend a month working in Haiti with my best friend Madison. A few days after our arrival, we were sent to the market for the Haitian cooks to bring back food for the following week. Everyone was looking at us, and we did kind of stick out. We had really white skin, weird clothes, and we didn't speak a word of Creole. But there was something else in their stares that was just different. After a while, Madison whispered to me, "Sarah, they know." And I looked at her, I was like, "Know what?" She said, "They know that we're Americans." She went on to say that when she'd been in Africa the past year, the people had been full of joy despite their difficult circumstances because they didn't know any other way to live. But here in Haiti, where Miami was just a 2-hour plane ride away, the people knew that in the U.S., we will never go hungry or die of a curable disease. Our children will not die of malnutrition. But all those things are normal occurrences in places like Haiti and countless other third world countries. There's no one solution to bring an end to famine and illness, but the use of GMOs, or genetically modified organisms, in the third world could be a good start. I want to show you that GMOs, while they have a bad rep in the US, could be used to save countless lives in the future. But before I can tell you how GMOs can benefit the developing world, we need to see the problem at hand. Now, for those of you who don't know what a GMO is, it is any organisms that genetic makeup has been altered in any way. An example of this is tomatoes. The enzyme that makes fruit soften has been taken away so that they don't go bad as easily. Almost all tomatoes in today's world are GMOs. In the US, GMOs are usually seen as something to avoid, as researchers do not know what eating them over a long period of time will do to the human body. However, this does not mean that they should be discredited completely. Claire Meyer stated in her article, "Public Views on GMOs, Deconstructing the Myths," published by the European Microbiology Organization's annual journal, says that scientists do not know or understand the full extent of their work and cannot anticipate the long-term consequences, meaning that the first world cannot simply circumcise what will happen. When I say first world, third world, some of us don't really know what that means. The third world are underdeveloped countries, and the real start to these titles started in the Cold War. The first world was defined as the U.S. and her allies. The second world was the Soviet Union and its satellite states, and the third world was basically everyone else. The third world was largely ignored during the Cold War as the superpowers were fighting it out, basically, leading to many of the problems we see today. According to the European Microbiology Organization's annual journal, 1 in 9 people are suffering from chronic undernutrition in today's world. It also goes on to say that food distribution is not the main problem of famine. There is simply not enough food in countries that are hit by natural disasters. The African News Journal states that over the past 10 years, 10,000 farmers have committed suicide due to poor harvests. And while most of us do not fear of dying of diseases like measles, citizens in third world countries risk dying from diseases like that every day. We know that there's hunger and suffering in the world, and we see the famine and illness is a real problem. But what is the solution? Well, the answer is there isn't really a good solution. For third world countries facing the risk of famine, GMOs are an underutilized resource. The study from the University of South Africa provided new data in their Transistic Organism Journal, speaks to how crops can help agricultural households with certain burdens. They can be engineered to have built-in insect repellent, and so they wouldn't have to pay for insect repellent or replenishing destroyed crops. But not only can crops help families, but governments of third world countries can benefit monetarily as well. Because more wealth is circulating throughout the given country, there would be less risk for economic recessions, leading to healthier citizens, meaning that there would be less medical problems. The reason transgenic crops are a responsible choice for certain economies is due to their resistance, as I spoke to earlier. Herbicide can help when crops fail. They can also be modified to withstand extreme turmoil, drought, excess winds, overwatering, and it's a great aid when fighting against famine. Scientists have also discovered that they can genetically modify crops to contain vitamins and vaccines, which could help aid the third world on many levels. There would be no risk of unsterilized needles, and the process of vaccinating would be much less stressful and effective. We've eradicated polio, and that could be a reality for many other diseases that in the first world we do not fear of dying of. GMOs could be used in the developing world as a means of reducing famine and malnutrition, financial burdens, and disease. We as Americans do not fear of dying of disease or starvation, but that doesn't mean that we shouldn't care about the lives about those who do fear this. As I spoke to earlier, the first world and the second world are largely responsible for why the third world is so underdeveloped. We just need to educate ourselves on the pros and cons of GMOs, as it is a great way to get involved in the conversation happening around when and how GMOs should be used. The population of the world is growing at such a rapid rate that the United Nations' most recent estimates of the world population, as it would have been in 2050, is 400 million over the previous estimated in 2010. That just means that more people's basic needs will need to be met. Dr. Mercedes de Ois in the Department of Nutrition for Health and Development in World Health Organization stated in the International Journal of Biology that the future of the human society relies on children being able to achieve their optimal physical growth and development. We can see how simply providing more food will help aid building a more peaceful future. We know that famine, malnutrition, and disease are major problems in the underdeveloped countries, and while there is no clear solution, using GMOs to prevent crops from dying and engineering food to contain vitamins and vaccines could be life-saving. We as U.S. citizens have a responsibility to care for the lives of people on this planet that we share. In the U.S., we do not fear of dying of any of the things previously mentioned. People in the U.S. say GMOs are unhealthy and dangerous to consume, but I've been eating GMOs my whole life. Now, I'm not saying that they won't affect me in the future, but I'd rather give someone a chance to live to 19 than die at age 5. Thank you.